Okay. Welcome to you guys to our Monday session on the science of metabolic dysfunction. I'm going to share my screen and we'll hit the road. Okay. All right. My name is Dr. Dieter. I'm a board certified internist and pediatrician. Today I'm going to talk to us about how most of the chronic medical conditions we face today come from something we call metabolic dysfunction, which is just simply a fancy word to say energy shortage. Okay. That energy shortage is in itself driven by something we call insulin resistance and microbiome dysfunction or dysbiosis. These two things, number one and number two, feed in and result in the causation of energy shortage. That energy shortage then drives most or even if not all the chronic diseases that we face today. So I'm going to examine insulin resistance and microbiome dysfunction and how they feed into the chronic conditions. What is insulin resistance? To understand what insulin resistance is important to understand what insulin does in the first place. Insulin is a hormone in the body, has a very important hormone. The job of insulin, makes it the most important hormone. I consider insulin to be like the CEO of the body, dictating the smooth functioning and structure of the body. When insulin is working well, everything goes smoothly. When insulin is not working well because it's so critical, things go awry. Why is that? Because of the job of insulin. And what is the job of insulin? The job of insulin is simply this. Insulin's job is to move glucose out of the blood, mobilize glucose out of the blood into the cell. You see, when we eat, the end product of absorption is that glucose is released into the blood. When that glucose is released into the blood, that glucose has to be moved into the cell. The job of insulin is to move that glucose into the cell. When insulin gets into the cell, it is shunted through the mitochondria, which is considered to be an organelle, the powerhouse of the cell. In the mitochondria, the glucose goes through a complex series of reactions called the electron transport chain with the result of an energy molecule called ATP. ATP is just simply an energy molecule. So we need energy. All the cells of the body need energy to function. The smallest entity of the body is the cell. Cells group up to form tissues. Tissues group up to form organs. Organs group up to form the system. The system forms the whole man. Every cell in the body requires energy to function. Why then is insulin that important? Because without insulin, we cannot make energy. And when a cell has the energy it needs to function, it functions smoothly. When a cell lacks the energy it needs to function, it malfunctions, then disease sets in. The simplest definition for disease is a cell that has malfunctioned. And the number one reason why the cell has malfunctioned is because the cell doesn't have the energy it needs to function well. And insulin, yeah, is important because insulin secures that energy. So when we say that you have insulin resistance, it means your insulin is not working well. And simply put, insulin resistance is when there is a breakdown in this process of insulin moving glucose out of the cell, out of the blood into the cell so that energy can be produced. That breakdown is called insulin resistance or your insulin not working well. So how do we go from a situation of insulin working well to a situation of insulin not working well? How does a breakdown of insulin resistance occur? It occurs in two ways. First, we call what I call too much fat. Okay. I want you to understand how the breakdown occurred because you understand that, then you can walk backwards to understand to be able to fix the problem. So too much fat causes your insulin not to work well, causes insulin resistance. Okay. How does that happen? A cell normally is supposed to look like this. Normally, when we consume more calories than we're supposed to, those excess calories, the cell takes those excess calories and converts those excess calories into, the body takes the excess calories, converts the excess calories into fat, and comes and stores it in this cell. So let me draw a replica of this cell. Normally, this cell should look like that, but when you consume more calories than you're supposed to, those excess calories get converted into fat. The fat now is taken and stuffed into this cell. And that becomes a problem because the fat now is occupying space in the cell that it should not be occupying. And now call this cell a fat laden cell. When this cell is fat laden, this is what happens. When insulin normally comes to the cell and tells this cell, hey, I got glucose in the blood, I want you to take it up. The cell has all the space in it that it can take it up. But when insulin comes to this cell and tells this cell, I got glucose in the blood, I want you to take up that glucose so that it could pass through the electron transport chain to make energy, the cell tells insulin, I'm sorry, I don't have any room in the inn. I'm filled with fat. If I were to bring glucose in, glucose is not going to have any place to lay its head. So the cell doesn't bring glucose in. Glucose cannot go through the electron transport chain to make energy. You have insulin not being able to do its job. We call that insulin resistance. Now that triggers the second stage of insulin resistance, where what happens? Because glucose cannot enter the cell, glucose now accumulates in the blood because it has no room to get into the cell. Now, there is a one-to-one relationship between glucose concentration and insulin production. When glucose is high, what happens is that the pancreas produces a high amount of insulin. So there's a one-to-one relationship. Now, when could we mute your microphones as you get into the room, please? When the amount of glucose in the blood is high, it triggers the pancreas to now produce too much insulin, which is a second way in which you develop insulin resistance, your insulin not working well. Okay. Now, too much insulin is not good. Remember, I described insulin as a CEO of the body that dictates the smooth structure and functioning of the body. Imagine a CEO of the company who was level-headed, running the company smoothly, and one day he comes to work, he has lost it. He has gone cuckoo. He's giving unreasonable demands, firing people for unjust causes, yelling at people at their face in their desk. You was gonna do it my way or the highway. The employees of that CEO look at him like this and like, what's going on with boss man? And they lose their respect for that kind of bullying and tyrannical behavior. When you have when you're an employee and you lose respect for your superior, your boss, it makes it hard for you to do what your boss asks you to do. You're not excited about what he asks you to do. So if your boss comes to you and say, hey, I have this project, Dr. Dieter, that I want you to get over the line in 30 days, but I've lost my respect for my boss, so I'm not excited to do the project. So if normally I'm the kind of person who does every project with my A game because I've lost my respect for the boss, I may give that project my B plus or my C plus game. I don't do it with all my heart. You translate that to the cell. When insulin is running too much, that insulin is being a bully and a tyrant to the cell, shouting in a high tone to the cell, terrorizing the cell. The cell doesn't take kindly, to that bullying effect of insulin, and the cell like loses its respect for insulin. When the cell loses its respect for insulin, the one thing that insulin asks the cell to do for it, the cell is reluctant to do. So when insulin asks the cell, open your doors year wide so that I can let glucose come in, because the cell has lost its respect for insulin, the cell reluctantly opens its door. Instead of year wide, it opens its door year wide. So because of a narrow door that the cell has provided, less glucose enters the cell than if the cell's door was year wide. When less glucose enters the cell, it causes more glucose to remain behind in the blood. That more glucose that remains behind in the blood is a trigger for the pancreas. This is more glucose remaining behind in the blood. It's a trigger for the pancreas to produce even more insulin. And even more insulin acts as a bigger bully to the cell. Even more insulin is like a CEO that was crazy this level and raises their cuckoo-ness to this level. The employees lose even more respect for the CEO. Translate to the cell. When insulin becomes even more elevated, the cell loses even more respect for insulin. When the cell loses even more respect for insulin, it becomes more and more it becomes more and more unexcited to do what insulin asks it to do. So initially, insulin had asked the cell to open its doors year wide, and the cell opened its doors only year wide. Now that the cell has lost even more respect for insulin, it now opens its door year wide, an even narrower door, which further escalates the issue of glucose accumulating in the blood and triggers the pancreas to produce more insulin, and the cycle goes over and over again. So that's what we talk about insulin resistance, and you develop it in those two ways. You have too much fat, and too much insulin. Too much insulin. And when that happens, your insulin is not working well. We say you have insulin resistance. It results in a slew of illnesses. All these illnesses are coming from the result of the fact that insulin cannot move glucose into the cell so that ATP, the energy molecule, to be made. The cell is now deprived of energy and malfunctions. So a lot of these illnesses here stem from the fact that insulin not working well. And this slide is not exhaustive, unfortunately. I cannot find a slide big enough to encompass all the modern day diseases that come as a result of insulin resistance. Let's talk about the second issue, the microbiome, or this second issue right here, the microbiome or dysbiosis. To understand what dysbiosis is or microbiome dysfunction, let's first understand what the microbiome is. It is a colony of about 30 to 100 trillion bacteria that live in our large intestine. That's what the microbiome is. And we live in a symbiotic relationship with these organisms, meaning we do for them, they do for us. We gain, they gain. We scratch their back, they scratch our backs. What we do for them is to provide them food and shelter, and in turn, they do all of this functions for us. I want to highlight two functions that the microbiome does. They help to protect the gut from pathogenic bacteria. Pathogenic just simply means disease causing bacteria. And they do so by producing a very special short chain fatty acid. Now, think about the cells of the gut as being linked to each other, one to the other, one to the other, like my fist. Okay. This is one cell, this is another cell linking together to form a wall here. Where my knuckles come together, right there, is what you call the tight junction, okay? The tight junction is like the security checkpoints of the wall. Now, these short chain fatty acids right here, those short chain fatty acids, they're like concrete. They go and pour concrete on these tight junctions to keep it tight. Because if these tight junctions are tight, stuff cannot escape out of the colon like toxins into the blood. But if they are not tight enough, there's weakness here. In that weakness, bacteria can now seep in into the blood and cause illnesses. So that's how the microbiome helps in protecting us from disease-causing bacteria. I want to spend a little bit of time about the function of helping to regulate the immune system. You see, you may not know it, but 70% of the body's immune system resides in the gut, and the other 30% resides in the resides in the bone marrow, the lymph nodes, the lymphatic. And the gut, the microbiome, is responsible for training the immune system, having the immune system have an appropriate response to what can be viewed as a threat, or an appropriate response to what can be viewed as not a threat. What does that look like? When the microbiome is healthy, it trains the immune system to say, hey, You see that bacteria right there? He's a bad guy, but he's such a weak bacteria. You could kill him just with a simple stone. You just take a stone and aim at him, you will take him out. So just take him out with a stone. You don't need any more excess force, for that. Then you may tell the immune system, you see that other bacteria right there? He's a bad dude. But if you were to use just a simple stone to aim at him, that stone wouldn't kill him. He's so bad that, for us to take him out, you need to drop a grenade in his backyard. You need a splash because this guy is a bad guy and can die easily. So it's giving the microbiome is giving the immune system an appropriate way to respond. This guy's a weak guy, you can kill him with this weak force. This guy is a very strong guy, you need this aggressive force to take him down. And then it goes further and tells the immune system, hey, do you see that guy right there? And the immune system says, what guy? I cannot see that guy. And it says, look well, that guy. And the immune system says, no. And the microbiome taps the immune system and say, you know what? The reason you cannot see that guy right there, just look again very well. He is in camouflage. He's wearing camo. So that's why you cannot see him. That guy right there wearing camouflage, he is not the enemy. He is part of us. He may look like the enemy, but he is not the enemy. Please don't fire on him at all. By firing on him, you'll be firing on one of us. So the immune system has now been trained by the microbiome to recognize what is not an enemy as not an enemy and not to attack it. Opposite is true when the microbiome is unhealthy. When these 30 to 100 trillion bacteria are unhealthy, they give the immune system an unhealthy training. That unhealthy training may look like they may be using too much force, what I may call cruel and unusual punishment. It may see a bacteria and it tells the immune system, hey, you see that bacteria right there? He's a bad guy. He needs to die or he's gonna cause you this disease. And you say, but we could kill this bacteria with a stone, but why use a stone? He's a bad bacteria. Let's just drop a bomb in his backyard. Let's drop a grenade. So a bacteria who you could kill with a small stone, the immune system, the microbiome is telling the immune system to drop a grenade, an overkill, a splash, an explosion that causes bystander injury to other cells and issues, overkill. That's what happens when the microbiome is unhealthy. It's ready for a fight. It's looking for any reason to fight. Even if that reason is small, it wants a big fight. And it takes it further. It trains the immune system, to fire without caution, even to somebody in camouflage. They may come to the immune system and say, look, I see that guy is in camouflage, but you know what? I know that when we see camouflage, it could be somebody who is a bad guy, an enemy, or maybe he's one of us. But the immune system, microbiome tells the immune system, you know what? I don't have time in the heat of the battle to try to figure out whether this guy who is in camouflage, whether he's an enemy or whether he's a friend. To be safe, let's just blow his head off. Let's just kill him. We'll take him to the autopsy table and determine whether he was the enemy or not. So the microbiome now, has given the immune system license to kill, somebody that is your friend, part of your camp. And that's how autoimmune diseases develop when the immune system has now been trained to attack cells of the body that may look like a bacteria, but that not at the bacteria. That is what an unhealthy immune system does. So those are the functions of that's what an unhealthy microbiome does to the immune system. And this slide depicts the functions of the microbiome. When we now talk about microbiome dysfunction, or another name for it is dysbiosis, it's an imbalance in this microbial population. You see about in the gut, you have bad bacteria, in the gut that is 50% in population, and you have good bacteria that is 50% in population. When we say you have dysbiosis, there becomes an imbalance where the bad bacteria increase to 70%, the good bacteria decrease to maybe 30%. I'm just giving an example. And the reason for this disproportion or this imbalance in the microbial population, normally they should keep each other in check, is the shortage of food. You see, the food for the microbiome is fiber. When there is plenty of fiber to go around, everybody is happy. When there isn't plenty of fiber to go around, that shortage sets into motion survival of the fetus. It's just like during periods of COVID. You went to the grocery store, all the bread is off the shelf, all the milk is off the shelf, all the tissue paper is off the shelf. Survival of the fetus. When there is shortage of food, there is panic and survival of the fetus. The bad bacteria, that are the stronger bacteria, hoard the little fiber that is there to themselves. And after hoarding the little fiber that is there to themselves, they say, you know what? For us to keep a hold on this fiber, that this little food, let us go ahead and increase our army so that we can keep our grab on this. And that results in that imbalance where the good bacteria go, the bad bacteria go up and the good bacteria go down. And when we have that imbalance, we say dysbiosis. When you have dysbiosis, it now results in a slew of illnesses like this. These are autoimmune diseases with the immune system attacking its cells, multiple sclerosis, autoimmune, lupus, autoimmune, Hashimoto. Again, this slide is not exhaustive. There are many diseases, modern day diseases, that are linked to an imbalance that we cannot put on this slide. I want to highlight anxiety and depression because when I first learned about anxiety and depression being linked to the gut, as a physician myself, I was surprised. You see, you may not know it, but 90% of the hormone serotonin, which is the hormone that helps to maintain mood, okay, the mood hormone, 90% of it is produced in the gut. The other 10% of serotonin is produced in the central nervous system. So when the gut is unhealthy, all of a sudden, this 90% doesn't get to the market. And if it's responsible for mood, then you could understand why anxiety and depression can be linked to the gut. This slide is a slide that I call a metabolic sequence of disease. It just simply shows that insulin resistance and dysbiosis, these core things that I'm talking about, result in energy shortage, which result in injury to the cell, which result in a chronic inflammatory state, which then cause the diseases and the symptoms. Now, there is now more evidence, more and more evidence that if you were to reverse the core of the problem, the insulin resistance, dysbiosis, you could reverse the disease conditions. Just as the evidence is there that these chronic diseases come from this and that, there is now evidence that you reverse those, the diseases go away. And I put it this way, think about it. If you're driving on the road and your car stops, your car runs out of gas and stops. It stops because the it has run out of gas, not because there's been intrinsic failure of the engine. Now, if you went to a gas station, you bought gas in a gallon and came back to your car on the side of the road and you put gas in that car is gonna start again because you have given it back the energy that the engine needed. There wasn't an intrinsic function, an intrinsic failure of the engine. So it is with the body, guys. Insulin resistance and dysbiosis result in a shortage of energy. And that shortage of energy now drives all these diseases. If you restore the energy shortage, those diseases go poof. Diabetes, blood pressure, high cholesterol, all go away because you have restored the energy. Just like a car that stops when gas runs out and starts again when you put gas in it, the body works in the same way. It is so simple, but it is so simple but so profound. And I want to present to you guys a solution which has become my most favorite tool in helping patients to be able to reverse the energy shortage. It's a solution called the Feel Great System, which is a nutraceutical. A nutraceutical is a product that is made 100% from plants but has nutritional benefits. For those of you here who are in the healthcare field, I want to say that this nutraceutical is very special that is listed in the PDL, the physician's desk reference. And what it does is it goes to the heart of the issue to restore insulin resistance and dysbiosis. There are two things in this nutraceutical. The very first thing is a tea called the Unamate. Unamate is made from a plant native to South America called the yerba mate plant. And this plant is rich in a special phytonutrient called chlorogenic acid, which is a polyphenol. The property of chlorogenic acid is two things. So one of the properties of chlorogenic acid is that it helps to burn fat. Okay, it helps to burn fat. So lipolysis. So if you remember how you developed insulin resistance, you had this cell that was filled with fat. So when you now consume the Unamate, which contains chlorogenic acid, which helps to burn fat, the fat in this cell gets burned, or lipolysis occurs, and this cell, which was fat laden, now goes to looking like this. It returns back to normal gradually over a period of time, returns back to normal. And what happens is this product with the chlorogenic acid is triggering fat burning to result in that transition. Now, what happens is that when the cell is now free like that, all the glucose in the blood that could not get into the blood now enters the cell. When the glucose now enters the cell, it could go through the electron transport chain, result in energy production. The second thing is that what happens is now the glucose concentration in the blood now drops. That glucose concentration in the blood drops because all the glucose has entered the cell. There's a one-to-one relationship between glucose concentration and insulin production. So when glucose concentration drops, it causes a message to be sent to the pancreas. Hey, pancreas, we don't need you to be producing as much insulin anymore. Our glucose levels are low. So the pancreas now goes to producing low insulin. It goes from too much insulin to low insulin. Now, low insulin is like a CEO of a company who comes into work one day and who was initially a bully that his employees had lost respect for, comes into work one day, calls an in-service meeting, and he's profusely and humbly apologizing. I've been a jerk for the last 2 months or so, and things I've asked of you have been unreasonable. Please, will you forgive me? The employees are taken aback by that humility. Oh, boss man is actually saying he was wrong for so and so and asking for forgiveness. They forgive their boss. And when they forgive their boss, they regain the respect they had lost for their boss. And they are now more open to doing what the boss asks. When the boss asks now jump, they say how high. You translate that to the cell. When insulin becomes low, it has become humble. It goes to the cell with a humble tone and gives an apology. And the cell now says, you know what? I could work with that insulin guy now. I could work with him. The cell now opens his doors. Now it's now open to to doing what insulin says, opening his door wide for more and more glucose. So the Unamate, by doing that, helps to reverse the two steps of insulin resistance, and then restoring energy in that sense. The second product in the protocol is something we call balance. Balance is just simply fiber. Balance does exactly the same thing. Exactly the same picture to reverse insulin resistance it does. But the other thing that balance does, which is fiber, fiber is very important for our metabolism. It helps to decrease your glucose spikes. It decreases your glycemic index. And I like to explain it this way. If you and I went to eat lasagna, and you ate at a February restaurant, you ate your lasagna without fiber, your blood sugar is going to do this. And that blood sugar may be a blood sugar of 170. For me, I know a thing or two about fiber. I know that when I consume fiber, it's going to decrease my glycemic index. It goes and cushions my blood sugar. And I know that this product is very saturated in fiber. What I do is I take consume the balanced product and I eat the same plate of lasagna. My blood sugar is going to do this. Okay, so that's you and that's me. We've eaten the same plate of lasagna, and my blood sugar may be 80. The consequence of that is because since you produce 170 units of 170 milligrams of insulin, your pancreas is going to have to produce a commensurate higher amount of insulin to deal with that glucose. So you may produce 20 units. For me, I've only produced 80 of glucose. My pancreas is going to produce a commensurate lower amount, maybe 5 units of insulin. I want you to think about 5 units of insulin as the humble CEO. When the CEO is humble, the employees respect him. And I want you to think of 20 units of insulin as the crazy CEO. That's what fiber does to you. Very important. And lastly, another thing is that fiber helps to reverse dysbiosis. Remember that I explained that the food for the microbiome is fiber. And when we do not consume enough fiber, it results in shortage of fiber, which causes dysbiosis, survival of the fetus competition. We don't consume enough fiber. Every living organism, whether it's a lion in the jungle of Cameroon, where I'm from, or it's a bacteria in the gut, requires nutrients. And the nutrients for the microbiome is fiber. And because we're not consuming enough fiber, we're having dysbiosis. So just by introducing the balance in here, you're nourishing the microbiome, giving it fiber, and as a result, you are reversing the dysbiosis that is one of the causes of energy shortage. So I'll end by saying these tools have become one of my favorite tools in reversing insulin resistance and dysbiosis and restoring the energy balance that has led to our diseases. And it is good news because if you suffer from any chronic medical condition, this can help you reclaim your health again. Thank you for listening. Dr. Kenny, I'll pass it on to you. And if you will unmute, Dr. Kenny.
Yes, sir. Got you, brother. Thank you, Dr. Dieter. I'm going to show just some kind of before and afters and have, Keith share his story, and then I can kind of share mine too. Wow, man, where'd it go? Sorry, ladies and gentlemen. I'm having trouble with this thing. There it is. There it is. So this is me, just to show people how fast insulin causes your body to age, as you just went over, Dr. Dieter. But this was me last year, February 26, 2024. I don't
And
even
you
know,
were
remember what
chubby.
oh, dude, I was more than chubby, brother. I got out of the like this is before I went in the hospital. So I was about 240 pounds right here. Chronic inflammation. I mean, just my joint pain was terrible. I couldn't sleep on my right shoulder. I had fatty liver, didn't even know it. I had started developing high cholesterol, put me in the hospital for almost 2 months. So yeah, you'd have had a field day with me, Doc. They let me finally go home after the first week, 2 days. I went home for 4 days. They never did the CT scan. So I had an abscess from the that they never did. So I went back home for 4 days, went back in the hospital for almost 6 weeks after this. My white blood cell count, I think it was either 34,000 or 40,000. And then after the hospital, I got out. This was me. Um, and between these two photos are 35 days, and I was fortunate enough to lose. I don't remember weight wise. I was around 50 pounds difference here, but my testosterone's back, my fatty liver's gone. I've reversed my AFib. I mean, I feel amazing. And this right here, well, this is Keith that will show. Sorry for shock value, but this is a diabetic foot ulcer. So we have more than just this one. Another friend that I've met through this, John Frost, also had a foot ulcer. But like this right here, what fascinates me, Dr. Dieter, is this is a husband and wife here. Now, they're supposed to be going into their golden years, right? Well, the golden years for who? The system or for them? And then this is them on the protocol. Now, I don't know about you, but I mean, if I saw that, I would probably ask that family, "What the heck are you guys doing?" Right?
Yeah.
And the beautiful thing about the protocol that Dr. Dieter shared is the company actually provides even a customer with this link because your family and friends are going to notice this. And our company actually provides a $10 coupon for anyone that you refer. So let's say you're like, man, this makes sense. I want to do this myself and I want my spouse to do it. You'll get a discount code that you can share with your spouse, and that'll save you and your family even more on this. Now, this is a friend of mine, John, I met through this. He lives down in Brownsville, Texas. And John, in this picture on the left, he's 67 years young. And this man had triple digit high blood pressure, both numbers. He had also he had sleep apnea so bad, he said he was waking up his neighbors, and he had fatty liver and had never touched alcohol. And he had heard me speaking about all these things. And he was like, I've got skin tags and belly fat. He goes, I got everything you say, and I've never even touched alcohol. And the picture over here, this was weeks. It was like 6 weeks. Guy's lost 60 pounds. His blood pressure's back to normal. His doctor could not believe it, and his fatty liver's gone. Now, here is the famous Dr. Dieter. Dr. Dieter, I think I had you beat. I definitely
I
pudged you,
was
brother.
chubby too.
And I mean, this Dr. Dieter, please correct me if I'm wrong, but I mean, you were 220, I think you said here, right?
Yes, 220 pounds.
You found the power of fasting, right? You applied it, I mean, obviously, and you were running, I mean, quite a bit. I think you said 3 times a week, pretty good
Yes.
distance.
Yeah.
And that was around 5 to 6 years between those two photos. Now, fast forward here into Mr. Slick, Dr. Dieter, right? Mr. GQ, I love it, brother. But here, I mean, you had just simply applied the tea and the fiber that you just shared, and this was a handful of months. And then I don't know if I have I don't think, no, I don't, but your sister's picture, I mean, identical twin, it was crazy
Yeah.
too, right? Now,
Yeah.
this is a friend of mine, Colleen. She lives down in Austin, Texas, and these two pictures are a year apart. And Colleen, God bless her, was getting tons of mood swings. She had diabetes. She's on 1/4 of a thyroid medication currently. She's off every other med. Her metformin is gone. Her cholesterol is gone. And this is all through blood work verified through a medical doctor. And so this is sustainable. This is food. I like to point that out to people. And it doesn't matter how many medications you're on. Keith will share his story. Now, maybe you know someone with an autoimmune disease. Dr. Dieter just explained this as gut dysbiosis, right? This is our friend Deb that I've met through this. And Deb was a size 12 here, severe insulin resistance. Her testosterone was so low, her doctor was wanting to inject her with it. She had headaches. She also had allergies. Again, going back to what Dr. Dieter taught you about insulin resistance and gut biome. And she was able to, in 7 months, by reversing insulin resistance and feeding her gut, detoxing the liver in this protocol, she dropped to a size 4. She's no longer getting headaches. Her testosterone's back to normal levels. Her allergies are gone, and her IBS, an autoimmune disease, is gone. So autoimmune works the same way, but it is named after the tissue that the body is confused and attacking. Now, Angelita, she's a nurse practitioner. And she was on 6 different medications for 10 years. She was on 5 for GERD and IBS. She was on 1 for antidepressants. And this was 2 weeks in, and Angelita was able to reverse insulin resistance, feed to her gut. She was able to get off all 6 of those medications in 2 weeks. One thing I want to point out, this is a box of the chlorogenic acid tea that you shared, Dr. Dieter. This is in Canada. And notice how it says low energy. And so this is because it causes your body to function more appropriately. Now, this is the last photo I will show. This is the other diabetic foot ulcer patient. So I just want to point out, sometimes people think, and I hear this a lot, and Dr. Dieter, I'm sure you do, this is too good to be true. Guys, we get pictures, videos. I got a video today of a lady whose eyesight no longer requires glasses. Her doctor couldn't believe it. She also reversed type 2. So, Dr. Dieter, thank you as always for your expertise. We truly appreciate your knowledge and especially you sharing something that is natural, safe, effective, listed in the same book where drugs are prescribed from. And I'm just grateful to work with you, brother. Thank you.
Thank you. Thank you. We're gonna take a few questions. We have about 20 more minutes, on here to take a few questions, and then we at the top of the hour, I have another meeting I need to jump onto, so we'll take questions. I want to answer Judith's question. Judith, the question about your friend and the blood pressure. So, caffeine, some patients will have that sensitivity to caffeine that's going to cause an elevation in their blood pressure. Um, I have seen this time and time again where decreasing the dose of the caffeine actually improves that. My father, I put him on this, and in the first in the first 1 week he was on, he had a worsening in his blood pressure and it had palpitations because of the caffeine sensitivity. I had him decrease the caffeine dose to half a sachet and using double the amount of water. My dad has been on this now for about 3 months now or so, and he tells me there are now days that he does not need to take his blood pressure medication at all. So we see that sometimes with some people, that transient elevation, a lot of the times, decreasing the dose to diminuate the caffeine does the trick. So, I mean, his doctor did only what his doctor knows the best to do to put him on medicines. If I saw that patient too and I did not know anything about the feel great system, I'm going to put them on medicines. I get it. I understand. That's the way we've been trained, But if you can convince him about going back, even maybe trying the decaf and doing a lower dose, he's going to see, he's going to see an effect. I think the issue that your hill to climb will be to trying to convince him that, hey, give this a try again at this, because that's what I would say to that. Now, the second question in regards to your friend, I'm going to answer that, and I'm going to let Dr. Tiffany chime in if you want to. And again, please ask all the questions you have to. We got until the top of the hour, and we'll have to hop on to another meeting. The second question you asked, should I be concerned that after 20 months of no period and thinking my friend is in menopause, after 4 months of the feel great system, she's having a period? So this is what I'm going to speculate, and this is just a speculation, okay? So, PCOS, which is the most common cause of an absent period, is um is very likely. It seems to me that your friend had PCOS that caused her to go into, what could have been a pseudo menopause, what you think was a menopause in itself, but a pseudo menopause, not really that, but PCOS mimicking menopause. When you have PCOS, polycystic ovarian syndrome, one of the common things is that it causes women not to have their periods. Okay. And so what I'm suspecting happened was that your friend had PCOS that caused her to have absent periods, and she interpreted those absent periods as if she had gone into menopause. And now she started using the feel great system. It has reordered her hormonal balance and had caused a reversal of the PCOS, and she's now seeing her periods. That's what I strongly suspect. But the best way to have that confirmed is for her to visit her primary OBGYN, for them to take a look at her, endometrial lining and what have you, and do some tests to confirm. But that's most likely what happened. Not really that she went into menopause and then came out of menopause. Dr. Tiffany or Dr. Kenny, you could
No,
add.
let Dr. Tiffany, but I was going to say, Dr. D, if you like, I can show a before and after of my wife a couple months apart because she
Yes,
struggled with
please.
PCOS for like 20 years. And like we had two miscarriages, erratic periods. She could not fast. She would get headaches, blurred vision, had to eat first thing in the morning. Took us 7 years to have our daughter, and in less than 2 months. I mean, it was insane. But Dr. Tiffany, please, I'll pull that picture up.
Oh, great, great, great. Hey, everybody. So, yes, I'm all with you, Dr. Dieter, entirely what you said. Some of the symptoms that perimenopause and menopausal have look like insulin resistance too. And I think that's the other thing. So, a lot of times we do get misdiagnosed. And so, PCOS could have been in the foundation of that, perimenopause could have been in the background of that. And so, once we start dealing with the insulin resistance, yeah, seeing those menstrual cycles come back, that's not that strange. In fact, we're happy when we see it happens for our women who've been struggling, like your wife here and they actually want to have children or that they're at the age to have children and we get to see them get pregnant. But of course, just like Dr. Dieter said, they need to see a provider just to confirm that that's what's happening and that there's nothing else sinister going on.
Thank you.
Thanks, Doc.
Mhm.
Okay, Dr. Tiffany, I'll let you take this other question. And Dr. Tiffany is a double board certified physician herself in family and lifestyle medicine. The question by Summer Hour, it's probably what if someone is taking losartan, can they get on these products while still on it?
Oh yeah, 100%. I know we all would agree on that. So there aren't any known drug interactions with the natural food-based products and taking a medication. But what you want to do is you want to monitor your blood pressure on a regular basis, see where it is, and you want to have a good relationship with your provider because even though we are doctors, none of us are going to tell you to get off of your medications here. But we want you to actually have the information to take back to your provider and say, this is happening. My blood pressure is dropping. My blood sugar is dropping. Can we adjust my medications? And a good provider is going to say yes. And so that's what we want you to do with that. Yeah, no concerns.
Okay.
Dr. Tiffany, when I got out of the hospital, I started this. I was on blood pressure, blood thinners. I was on a bunch of stuff because I had freaking, you know what I mean? And I measured my blood pressure just like you said, and I didn't need to take it again from day one in my case. I mean, so,
Wow.
yeah, but I was measuring it. My wife's like, so she's an OT, so she was freaking taking care of me because I couldn't even argue. I was so weak.
Wow.
Uh,
Yeah,
Mhm.
Gladys, the question you asked, how will you know how you can stop taking your medication? I think Dr. Tiffany just answered that question. You want to work hand in hand with your provider. If you start taking the Feel Great system and you're on blood pressure medicines, if you have a home blood pressure machine at home, you want to be checking your blood pressures so that and writing them down, and you can take those figures with you to your provider to say, hey, listen, I started taking this. This is what my blood pressure was before that. This is what my blood pressures are doing right now. And they can help you to do that. You do not want to stop your blood pressure medicines or any other medicines without the feedback of your doctor. Now, if I were your doctor, I'll help you to do that. But that's why we say you have to go to your doctor to try to navigate that.
Oh, yes.
Yeah, we got them. Also,
Okay.
money too. All of it.
Okay.
Leverage. Wait, let me see. Let me see.
Uh, we mute whoever is talking.
Okay, Charlie, there's the master transfer webcam
Hey,
video
Dr.
file.
Dieter, did you say Judy? Judy was I think it was Judith. Judith, what I have found to work really well, and I'm sure Dr. Tiffany's been doing this a long time, Dr. D's probably seen it too, is take a balance when you're getting that, and it crushes that. I mean, absolutely. It's a gut issue. Dr. Dieter can explain this very well. And it's a
Yeah.
bad bacteria in the gut, and that balance just crushes that thing. So,
Mhm.
Mm-hmm.
Yes.
The balance can.
Yeah.
Mhm. But salt also does it too,
yep.
because my mother was struggling with this. And she didn't want to believe me because I had her doing a balance at first. And she was like, oh, that's not doing it. I don't know why it's happening. Because, my mom's 74 and she doesn't fully grasp all of this entirely, though she's on it. And so I actually started getting her just do a pinch of Himalayan salt on every morning. And it knocked this out for her. And she's not having a heartburn anymore.
Yeah, salt's your best
That's
friend, right?
good.
I use
Yeah.
salt all the time.
That's good. So, folks, we have another 10 minutes to answer any questions that you may have, and then we all need to hop off. So, if you have any questions, please, now is the time. And we do this every Monday, every Sunday, and Mondays to try to enlighten, to try to educate our community and America and even the world little by little that our modern day diseases are 100% reversible. And so we would like to take as many questions as possible to be able to clarify any things for you.
Happy Thanksgiving, everybody.
Right? Yep,
Thank you.
that's good. And also the detox. Dr. Esther put in there the detox symptoms of doing the whole feel great system, how you can get worsening acid reflux. That was good. She added that.
Yeah.
Mhm.
And if
Thank
you
you,
get if you
Pastor.
get constipated, make sure, as Dr. Tiffany said, add some salt. We've got some there. I don't know if you even mentioned this, Dr. Dieter, but this Signal is incredible. It's
Yeah.
got the electrolytes you need. It's got beetroot, right, for nitric oxide to open up blood vessels for blood pressure on top of what you're already doing with what you explained. And it's got the L-citrulline for the cardiovascular effect, and it tastes really good. You can taste the beet in it. If you're not a beet fan, I'm honestly not a beet fan, but I understand how powerful it is. So if you keep shaking it, it'll make it taste more like fruit punch because you get more of the minerals going. So depending upon how you like the flavor, you can kind of mess with it a little bit, just so you know.
Okay. A couple of questions there. Can somebody take this when they're pregnant? Absolutely. No contraindications while you're pregnant. This is made 100% from plants. It is food. And you could ask the other question, can you eat food when you're pregnant? And the question is absolutely, because these are products made 100% from plants. So there is no safety issue in pregnancy. Um,
Say, Dr. Dieter, I was going to say too, I've got a lady, she's 102 using the protocol.
102 years old?
102, yeah.
Wow.
So, and I've seen 1 year olds do this. So,
Okay.
Yeah, my
yeah, so
2 year old. I have my youngest is two, and my 2 year old. I have a 2 year old, a 5 year old, and a 7 year old that I give them to. My 6 month old. Once she starts taking liquid, she'll get on this.
yeah.
uh, yeah. So
I
there's
believe she's
another.
asking about LDL or cholesterol, excuse me, Dr. Dieter.
Yes, yes. What was the question? Let's see. This is scary to me, especially as a diabetic, because it seems you may go into a yo-yo effect
I
blood
know.
No, it's
after
complete
your
opposite,
blood
Gladys.
pressure may go to low instead of high levels when you check blood sugars. I don't think I understand the question. Do any of you do?
I think she's trying to say she's afraid if she's not eating, she's going to have blood sugar. It actually does the
Hmm.
exact opposite, Gladys. My cousin is a type 1. She became a double diabetic. Kind of thought I was crazy. Many people in here know this story. She called me up and I just said, well, Vicky, like, you called me. I mean, like, right? Like, and I was like, I know what you've been taught. And in, I think it was a week and a half in her case, she had dropped her insulin use as a type 1 by 62%. So when you're
Yeah,
sipping that tea, you're keeping blood sugar nice and level and stable. So glad as you know, if blood sugar stays low, do you need to inject more or less insulin? What's causing
Hmm.
your ups and downs are the food that people consume.
yeah,
And when you stabilize that, when you wake up in the morning, your insulin's low. And if you use this system, it'll keep it low. And
yeah,
so you will balance right out. She uses 79% less insulin as a type 1 diabetic and
It's
reverse type
awesome.
2. So, yeah.
yeah.
Awesome.
I have a type 1 diabetic who had been on it for 4 days, and she sent me an ecstatic text message to say, Doc, I have been on this for the last 4 days, and I cannot remember the last time I felt this good. She had decreased her insulin requirement in 4 days by about 54%. In four
Wow.
Holy, 4 days.
Yes.
Dr. Dieter,
That's
someone's asking
crazy.
about eyes. This just came to me today. If you guys have a minute, I can play a
Yeah,
video so
please,
you can hear it.
please.
So, this is from somebody who actually, she's been using it since December let me think about this. Last year, she started December. And she was able to reverse her type 2, and she had a hip replacement, so she couldn't even walk, she couldn't go to the
Mm-hmm.
gym, didn't go through PT. And this beautiful lady just sent me this today. I'm gonna probably get teary-eyed because when she sends me this stuff, where's it at? Here we go. Sorry, ladies and gentlemen, I got to find this. Okay, so here we go. All right, here we go. Can you guys hear this, Dr. Dieter?
Yes.
No, we
No, no,
cannot
no.
hear. I
Okay,
think you
one sec.
need to share your share the sound also. I
How do I
learned
share? Do
that.
you know how I
Yeah.
share the sound?
Just go to the same way as you share your screen. You're gonna see a place where it says share sound.
I just say share screen.
Yeah, look on the right hand side. You see you have to check the box that says share sound also.
Say more.
Yeah. Did you hit the share screen?
It never lets me do. Let me just. You know what I'll do? I'll take it off share and I'll hold my phone up and hopefully you can hear it that way because I don't. It's
Sure,
not gonna let it do. I'm so sorry.
sure. No problem.
So this is her name's Susan.
Hi, Dr. Kenny. I know it's been a while since I've talked to you, but I have some. Hi, Dr. Kenny. I know it's been a while since I've talked to you, but I have some exciting news I wanted to share with you first. I just came back from my eye appointment, and I was so nervous about it because I was having some issues with my glasses and seeing some changes going on. But the good news is my glasses are too strong for my eyes. And that to me is like a blessing. And there's no inflammation in my eyes. And they showed me last year's pictures and the present. And I started talking to the doctor about the tea, and she was just so elated that my eyes were looking so good. So I wanted to share that with you. And thank you from the bottom of my heart. Thank you so much. This has really made a difference in my health. And
That's Susan. So that's why we do these calls, guys. We
Yes, it
get these
is.
messages every day. I get teary-eyed. I mean, like I can't even, I cry all the time doing this business, man. So it's funny you asked that because I mean, I literally, honest to God, got that video today.
Yeah, that's great. We'll answer some other questions really quickly. We got a few minutes to wrap up. The question about any age recommendation, I think Dr. Kenny answered that. We have a 102-year-old using it. My 2-year-old daughter is using it. As as far as the question, but can it help with all eye disease? The word all, I don't want to put a blanket to stuff. There's certain things which, it may not help with. But a lot of diseases, are linked to insulin resistance. What I can say is if you have an eye disease, and that eye disease is linked to insulin resistance, it's going to have some effect to it. I don't want to be cavalier and say, yeah, it's going to help with all eye disease because I don't know what all the other eye diseases are out there, but anything linked to insulin resistance, it will. Gladys, I don't know if you just meant to ask a question or if you were just saying that if you're a type 2 and you're on Ozempic, by the way, there's no contraindication to using this. You can use this actually, and there's some people who have better effects on this than they do on Ozempic.
Mhm.
And I hope I touched on all of that. Judith, I'm glad to see what you posted in there, your comments about your chronic fatigue and your plantar fasciitis and all of that. Guys,
The
I
only one left is the cholesterol question, which we
yeah,
don't
the
need to,
cholesterol
because
question.
I mean,
Yes, this
yeah.
helps. This helps to bring down cholesterol, guys. I wish I could share my screen.
Oh, Dr. Dieter, I can, let me show it to you real quick.
Good, great,
Yeah.
great, great. Man, yeah, brings down cholesterol. My cholesterol dropped by 69 points, and my total cholesterol by 64 points, LDL by 69 points. It's so many people that it brings their cholesterol down. Perfect for cholesterol. Yeah, thank
Yeah,
you.
Hmm.
so
This is
right
great.
here.
Yeah.
11%. This is the PDR, which is where Dr. Tiffany, Dr. Dieter prescribed drugs from. 11% reduction in triglycerides in 30 days. Drops A1C by 3%. Metformin does 1 to 1.5% with a black box warning. So that means you could die. This right here decreases pre and post granular glucose levels, decreases lipoprotein B, which is pattern B, the dense LDL that you don't want. And then this shows, another study shows, sorry, the 2 waffles that people were fed, 2 tablespoons of syrup, 10 ounces of OJ, using a continuous glucose monitor. It's 51 grams of sugar. This reduces blood sugar spikes by 43%. Metformin does 25 to 30%. So, guys, this is 0 side effects. You can try it risk-free. It's less than a cup of coffee. So,
Yeah. Thank you guys for joining us today. We're right at the mark. We're out of time. If you were invited to this call today by somebody and you've learned something new and you're interested in trying the products, please get with whoever invited you. They can give you a link on how you can get the product. And I say this, we're always looking for people to join our team. We are on a mission to help as many people to become aware of the fact that they could experience true and lasting health. So if this sounds like a worthy mission for you to be a part of, please talk to whoever invited you. We will love you to join our team. Thank you for being part of our call tonight, and good night and happy Thanksgiving.
thank you
Good
so much,
night.
Doc. Thank you, Dr. Tiffany.
Right.
Thank you, Dr. Dieter.
Thanks, Dr. Deere. Thanks, Dr. Kenny.